Question, or not questions, but statements.
I would like to call the July Resident Services Commission to order. Please have announcement and new EMS commission appointments.
We have a couple of new faces at the table, and so I want to announce the governor made a couple of appointments to open positions that were on the EMS commission. And the first one was, we had announced last time that we had a hospital administrator or a hospital that provides emergency medical services. And we are adding Lisa Clutie, has been appointed for that position from Harrison County Hospital. If you want to add anything to that?
Happy to be here. So I'm a family practice physician by training and practiced family medicine in Harrison County for 18 years. Became the CEO of the hospital there in January of 22. So we're the sole EMS provider for the county. It's actually the largest department of our hospital, counting our PRN employees. And so, you know, it's a lot of work, and some weeks I think they need their own HR department, et cetera. But I'm heavily involved with EMS. The director reports directly to me, so I'm very involved. I always say, if you're sad and lonely, go sit with the EMS group, because they'll certainly pull you out of it. I love to hang out with them. Thank you.
The second position that the governor appointed on was the representative of municipal law enforcement or fire. And in that position was held by Darren Hoggett, who has inactive his EMS status. And so he has been moved to the public position that had been vacant for a long time. And as the new representative of municipal fire is Patrick Hutchinson, Westfield Fire. What would you like to say?
Yeah, so I've been at Westfield Fire Department since 2019. Prior to that, I was at Indianapolis CMS and SKSA Health as an educator for 22 years. Still continue to work part-time as a flight paramedic for Iowa Health Lifeline, so excited to get involved.
Those were all the changes that were made. We are now fully appointed for all positions. I mean, so no one quit.
Okay, with that, Emily, could we have termination?
Yes. Matt Shady.
Here.
Darren Hoggett.
Here.
Dr. Lisa Clooney.
Here.
Patrick Hutchison.
Here,
Lee Turpin.
Here.
Jerry Harder.
Here.
John Zartman.
Here.
Dr. Sarah Brown.
Here,
Matthew McCullough.
He's not on one.
He said he would not be, he might be in and off today.
Yeah, and you can be online at some point. Andrew Bowman.
Here.
Mary Ann Dudley. Here. Dr. Jim Nauset.
Here.
Lori Maley.
here.
And Director Thacker.
Here.
You have one?
Thank you. And with Commissioner on the line, I assume we do need to do roll call. With that, if we would, from please stand, take the flag, pledge allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Moving along to item C, adoption of minutes, pleasure of the commission. Motion to approve, approved by Commissioner Zartman.
One correct. On page 5, under old business, where it talked about the Glucagon decision. Every where it says Gluco, that we should be changed to the word Glucagon. And my vote was reported that yes, should have been an abstention for coming to me.
Will entertain changing your motion to adopting with the changes.
Yes.
Indication yes, Commissioner Zartman.
Second,
Second from Commissioner Hall. Any further discussion? Okay, call the roll call.
Matt Shady.
Aye.
Darren Hoggett.
I,
Same as I present.
And Patrick Hutchison.
Abstain.
Thank you. Lee Turpin.
Aye.
Barry Harder. John Zartman.
Aye.
Dr. Sarah Brown.
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley. Aye. Dr. Nopeth.
Aye.
Lori Bailey.
Aye.
And Director Thacker.
Yes.
Motion, that's been adopted. On to honorary certificate.
The honorary certificates are there, no action needed. We do have emeritus we just awarded to EMT paramedic Kenny Mean, who died tragically last weekend. And so I know Stan is presenting that to the family later today. I also, we record these and then Emily takes them off. And I think I forgot to record on the sheet here and reminded me, we did recognize Jill Perry with an emeritus for her long serving when she retired from St. Vincent Hospital. And so we'll get her added to that sheet. That is all I have on the record.
Moving on to Indiana Department of Health. Trauma system update.
Didn't see anyone online, I don't believe. I had a few that I jotted down, and I'll see if Dr. Gazel has anything to add. We did have a trauma change, and I think we talked about last time, the Terre Haute Regional is dropping their level 3 as of August 1st. However, Union Hospital remains as a level 3 in the Terre Haute region in that area. And then the Indiana State Trauma Care Commission did meet on May 3rd, mainly working on some committee work there. And the next meeting dates for it are August 2nd, November 22nd. Both of those are at the Indiana Department of Health. And I know they are very engaged both with IDHS, but also want to remain engaged with the EMS Commission as well. They have announced they are working on a statewide trauma and emergency medicine symposium December 4th and 5th. And so they're watch for that. They mainly issued the save the date right now, but that'll be up in Fishers. Anything else?
No, the Making the Performance Improvement Committee met yesterday as well as part of the Trauma Commission, working on some data collection and eventual dashboard development for EMS services, specifically regarding like trauma center utilization and things like that, destination decisions. So there'll be some useful information that comes out of that. So let's see what that was.
Moving on to item F, legislative update.
So we are getting ready for next legislative session. Our office is reviewing whether we will have any enactments. I can tell you, we only requested one item, but it'll be reviewed internally, and if we proceed, we'll update on that. We do track what the other partner organizations are doing, and we'll start reporting back. We do have a couple of follow-ups in the work, such as behavioral health education is going on. And we are developing that in the background. So I look for some announcements on that coming up at the next meeting or two. The big thing we have right now is House Enrolled Act 1302, which is the county survey I announced last time. And the time deadlines are in statute. We have a few more days till July 15th for each county to respond. And then we have to prepare a report, Homeland Security does, by August 15th. I have a process, I did catch that when I updated, we have determined process. So it is out there. Each county commissioner has been issued an email with a link that they then can upload for the county. And then the EMS providers in the county are issued where they can update each provider as well. And so it's kind of a joint effort. When we last checked, and this could have changed, I checked on it late yesterday. But we have 32 counties that have finished their surveys, so around a third. 41 counties have started, which was good. But we did have 19 counties that we've issued email, but no response. And we are reaching out to them one by one. But if you are a county or know someone in a county that is in the light color or the white then we need a response from them, please. So that way, they are represented in that statewide survey. I would also note, when you look at EMS providers, not much better. 208 providers have submitted, which I think is good, but only 60 counties. And also we have over 800 providers, because this includes BLS non-transport, which would be a lot of volunteer fire. So we have a lot of room to get more submissions there. So that's just the big keyword today is we need your help. This will inform decisions, could potentially inform legislative action. And so it is important that we have buy-in to this survey. It'll take a little bit of time, but I know I have heard some of the EMS providers say it took like 20 minutes. So it's not bad at all. I think those are all I have.
Any questions for Director Kim? Hearing none, we'll move on to minutes for children. Martin.
Have it remote if you press down. It'll.
Okay, today I just wanted to go over the pre-hospital pediatric readiness project update that we shared last commission meeting. This is the last time I'm going to ask you because we don't have to do this again for 5 years. So if you could on your device, look up emspedready.org and go ahead and click on start the assessment, drill down to your county, and then you'll see the list of those agencies that haven't yet taken it. And my ask is that you reach out to them and let them know about this important assessment that's currently underway. So this is an all 57 EMS for children programs response rate currently. If you do look at Indiana, we are still response, but this map is a little deceiving because a lot of these states have EMS agencies that are less than 200. And so right now we have 268 EMS agencies that we're trying to reach by the end of this month. This map shows you red is good. And so we do have 11 counties with 100% response rate. Ohio and Hancock were the first 2 counties in the state to have all their EMS agencies complete the assessment. And then Benton, Boone, Fayette, Franklin, Scott, Floyd, Perry, Spencer, and Vanderburgh have all had 100% responses. And there are 4 counties, there are 10 agencies total: Blackford, Warren, Martin, and Orange, where there have been no response rate. And so over time, these last 2.5 months, we've been sending out email reminders, presenting at the EMS district forums, the importance of the assessment, newsletters, social media pushes, phone calls, and then EMS district managers have been working diligently to try and increase our numbers. We've talked in the past that this assessment was based on guidelines that were released in 2020 to see how each EMS agency is delivering pediatric care. And so once they take it, they do receive a gap report that comes with tools and resources on how they can improve their pediatric emergency care within their agency. It is confidential. It is a self-assessment. And so the person that completes the assessment gets the data. They have an opportunity to take that data to their medical director and talk about how they can improve pediatric emergency care. It is open until the end of July, so we do have 20 more days to try and get an 80% response rate. And I selfishly would like for all EMS agencies to complete it so that they know exactly how they're providing pediatric emergency care. In these next 20 days, more phone calls. I do have a challenge with phone calls. Someone's either not answering or it's a wrong number. And so if you know who that person is, please reach out to them. There is an upcoming district forum meeting in July. Well, I guess next week, it is July. In Vincennes, continuing to do a social media push. And of those 268 EMS agencies that remain, a lot of those are your BLS non-transport. Trying to reach out to those specifically, because oftentimes those are the providers that are first on scene in rural Indiana. And so we want them to be aware of their pediatric readiness. think I might, oh, sorry, here we go. So this is a breakdown by district of where the EMS agencies that remain are. And I plan to send out an up-to-date non-response list to the EMS district managers so that they're aware. But yeah, just 268. Again, the website's EMSC Peds Ready, or sorry, not that. It's EMSPedsReady.org. And if you could just reach out to your colleagues across Indiana and let them know the importance of this self-assessment.
Questions for Bob?
Thank you.
Next up, Indiana Fire Chiefs Association EMS Division, insights.
No major updates. The registration now is open for IERC for October. Again, there's save the date, October 2nd to the 5th, up in Noblesville, different location this year, and hope to see everybody.
Thank you. Indiana Emergency Medical Services Association, AMAS. Or Bob Butler, either.
Definitely not Nate. Just a couple of things. If you didn't make the Golden Siren Banquet, we want to congratulate some winners just to let everybody know who they were. The 5 inductees this year, one was Robin Stump, Dr. Nauset, Brian Peterson, Jerry Miller, and Mel Tucker were the 5 inductees as the Golden Sirens this year. So all well deserved. And again, we'll be looking for the next group here next year. You all received or should have all received a card this morning handed out on our conference. We wanted to get some information out ahead of time, but the pre-conference classes that you're going to have this year are going to be posted very shortly. But you're going to have the Tim Phelan cardiology class. The cadaver lab is going to be there, which will have 4 different sessions. These are all on Wednesday, the 19th of November. The MIH symposium, we do have 1 spot left for a speaker for that symposium on the pre-conference. If you want to present or know anybody that wants to present at that, let Nate know. We can get that abstract through for that pre-conference. That's sponsored in combination with IDHS, NAMI HP, and Phoenix Institute of Paramedicine. They're sponsoring that MIH symposium that day. It's going to be a lot of good speakers. So there's going to be a TNCC class. There's going to be a burn class, a Moulage class. So a lot of great things at the pre-conference. The pre-conference classes are only costing $50, and that is basically what we're using to pay for lunch that day. So we're not even really charging for the pre-con classes, so feel free to join us. Registrations are open, and the abstract, if you want to present at the conference, need to be in by the 15th of July, so a couple of days, and that's going to close. Is 15th on still? Is it closed? Okay, they did actually close. I thought we extended, but they did close, so.
We extended it just for the few that were locked up in half done, not completed. So that part was extended. We closed it at that time.
Okay, I misunderstood. So it's closed. They're going to be, if you submitted, they're going to start looking over, reviewing everything. So don't panic if you haven't heard yes or no yet. They're just now starting the review process. There were almost 100 abstracts submitted for the conference. So that's phenomenal. A lot of great speakers from all over. The Governor's Cup, last thing I have. If you haven't seen emails, you'll see it on the website shortly. You're going to see it in emails and so forth. The Governor's Cup is back this year. By unanimous request, we have added an extra category this year. So you're going to have EMT paramedic, and then everybody wanted a critical care. So it can either be paramedic, or paramedic nurse for the 3rd category this year for the competition. Dr. Yazel has been involved with helping write the scenarios. And the judges that come in are from outside the area, so they don't know anybody. So you're gonna see it coming up. The competitions are September and October. They're gonna be in the regions. We'll let you know where they're gonna be. You'll sign up, you'll compete. The winners of each region will then come down to the conference on November 19th, and you'll compete for the finals. And then we'll award the medals and so forth down at the conference. So registrations are open. A lot of great things at the conference. If you have not been there, I encourage you to send staff, come down yourself, pass the word. This conference has grown. Last year, we had 450 people there. We expect more this year. We even get calls from outside the state. So if you have any questions, reach out. Myself, Tom, Nate, anybody back at the table back there, Gary and Jeremy, we'll get you information. We'll help you get hooked up. And that's all we have.
Okay. Hearing none. Education Oversight Committee, Commissioner Clark.
Mr. Chairman, I am honored to say today that we are just a little bit late on the timeframe, just about 30 days, but the projected date to start the new advanced EMT second motor exam is going to be August 1st. The committee met here a few weeks ago. We finalized the training scenarios, the testing scenarios. They have been submitted this morning to two medical directors that were chosen by the commission to review those for validation. So gentlemen, you'll find those in your clock, Dr. Nelson. Once those are clear, Carrie is planning on utilizing a direct contact now that the state is looking at doing the website request for the exam, just as they do the basic exam, to request those for the regional examination sites. And the other aspect we need to point out mainly for the audience is remember that as of July 1st, the National Registry is no longer doing any type of psychomotor exam. So those candidates that were in midstream under the old now automatically convert to the new exam for Indiana. I'll give you more of a little bit of detail to how she handled that and those requests and so forth in her report. But I do want to take this opportunity and thank all those people that served on the committee, Director Kinney and Carrie's input and hard work on this because it's taken a lot and they've done an amazing job of getting it set up to do it. And also in your package, you should find a summary from me outlining that. I have a suggestion, and I apologize, Commissioner Zartman, I didn't think of it till now. So we are after July 1st, and the way the rules read is that all levels test a written and practical examination as prescribed by the commission. So currently, the advanced EMT would be you take National Registry written, National Registry practical. There is no practical anymore at the registry. So I would suggest that we change that procedure to the pilot program that is being developed until further notice, just for the practical process for advanced.
That's a motion. Okay. Second by Commissioner Shea. Any discussion? Let's follow.
Okay. Matt Shady,
Aye.
Darren Hogan,
Aye.
Dr. Clooney,
Aye.
Patrick Hutchison,
Aye.
Lee Turpin.
Aye.
Jerry Harder.
Aye.
John Zartman,
Aye.
Dr. Brown,
Aye.
Matt McCullough online now. Andrew Bowman,
Aye.
Mary Ann Dudley,
Aye.
Dr. Knopfit,
Aye.
Lori Bailey,
Aye.
Director Packer.
Aye. Any further questions for Commissioner Zartman? Seeing none. Mobile Integrated Health Committee, Richard.
We did meet on June 10th. I was on the call. Andy Van Zee stepped in and chaired the meeting because Dr. Yazel was attending conference in Florida, and then I was preparing to go to the Indiana Volunteer Firefighters Conference where I spoke. Yes, that's true. Sorry, that's right. We did nothing. So it was chaired by Andy. I was on the call. Good discussion. We have recommendations for 3 approvals that Emily will get. Otherwise, we're talking about things like the MIH conference at Crossroads, and then also making sure that people understood the grant opportunity, which we're going to discuss as goals. I'll turn it over to Emily. Right.
Okay. So down goes next.
You do not have, you didn't get any slides, so I don't have any.
Oh, okay.
Sorry.
No, that's okay. Okay, so the programs that we are reviewing today are Crown Point Fire and Rescue Department. We have Morgan County EMS and Pike Township Fire Department. So our first one is going to be Crown Point Fire and Rescue Department. They're located in District 1, covering Lake County. They will be providing hospital dismissal, post-discharge follow-up, and readmission prevention, as well as post-response follow-up for certain emergencies such as diabetic or overdose, diabetic counseling and monitoring, chronic disease management, decreased utilization of EMS by high-frequency patients, substance abuse mitigation, OB and newborn management programs, elderly management programs, immunization and vaccination initiatives, home safety surveys, including carbon monoxide and smoke detector inspections. The goals for their program are to increase access to primary care healthcare, the healthcare network in their community, reduce emergency room visits and 911 utilization by accessing their community resource partners and improving patient outcome and continuum of care. They also assist their citizens to age in place safely, securely, and with confidence, and make sure that they have their necessary resources at their disposal. They'll provide all home encounters with a home safety survey, which includes a general wellness assessment, a fall risk assessment, and a home safety assessment. Crown Point Fire will also look to establish a vial of life medical information management program for first responders. For education, their minimum requirement standard is their fire department standards, as well as the paramedic has to be in good standing with IDHS, Franciscan Crown Point EMS Academy, and Crown Point Fire Department. They would like to add an NAMT course, the GEMS course, as a standard requirement as well. And within 1 year, they would like their paramedics to have a IBSC community paramedic certification as well. So our next program is Morgan County EMS. They're located in District 5, covering Morgan County. They will be providing hospital dismissal and post-discharge follow-up, post-response follow-up for certain emergencies, diabetic counseling and monitoring, chronic disease management, as well as decreased utilization of the EMS by high-frequency patients, as well as substance abuse mitigation, mental illness mitigation, OB and elderly management, and immunization and vaccination initiatives. Their program goals are centered around providing the residents of Morgan County a service that will assist in living a healthier life, having a better understanding of the healthcare system, and helping them navigate it while providing them with local resources. They will also require their providers to take a community health worker course, a GEMS course, and trauma-informed care. So our last provider that we are reviewing is Pike Township Fire Department. They're also located in District 5, covering Marion County. They will be covering post-response follow-up for certain emergencies, decreased utilization of the EMS system by high-frequency patients, substance abuse mitigation, mental illness mitigation, elderly management programs, as well as they have Project Lifesaver, and that is a premier search and rescue program operated internationally by public safety agencies and is strategically designed for at-risk individuals who are prone to life-threatening behavior of wandering. So their program goals are, they aim to enhance the accessibility and quality of healthcare services for their target communities, as well as leveraging mobile technology and a network of healthcare professionals They will deliver timely medical consultations as well as health monitoring and emergency response services directly to patients' homes. The initiative is designed to reduce hospital readmission rates, improve patient outcomes, and increase overall satisfaction of the healthcare system. This is also to provide accessibility of high-quality healthcare services to underserved populations, as well as mental health, overdose, and diabetic. They are also willing or hoping to decrease the burden of traditional healthcare facilities by offering alternative care options, providing a liaison between healthcare facilities. Also utilize ESO mobile technology to facilitate real-time monitoring and communication between patients and providers, as well as to improve patient outcomes and satisfaction through personalized and convenient care. They do not have any specific additional training at this time, but they did state that they would like to enhance the training of healthcare professionals to keep pace with the evolving medical standards and technology advancements. Those are our 3 programs to review.
So the MIH committee did review all 3. We are recommending approval of Crown Point Fire and Rescue Department, Morgan County EMS, and Pike Township Fire Department.
Pleasure of the commission. Motion to approve. Seconded by Austin. Any further discussion or comments? Okay, we have roll call vote.
Okay, Matt Shane.
Aye.
Darren Hoggett.
Aye.
Dr. Clooney.
Aye.
Patrick Hutchison.
Aye.
Lee Turpin.
Aye.
Jerry Harder.
Aye.
John Gortman.
Aye.
Dr. Brown.
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley.
Aye.
Dr. Nauset.
Aye.
Lori Mailey.
Aye.
And Director Patrick.
Yes.
Motion passes.
That's all the MIH updates I have, other than our next meeting is Friday, August 9th, out here at Maid at 10 a.m.
Okay, moving on to new business, MIH grants, fiscal year 2025, recommendation approval, right?
So we heard last time, or you approved a notice of funding opportunity. Again, the basic requirements have to be an EMS provider organization, must be a city, town, or township operated provider, and must be an approved MIH program. Our priorities areas that we were looking at was new or expansion of existing programs that demonstrate community need, programs that include cross-disciplinary cooperation, and programs that propose matching funds. Award information, we had 500,000 available this year for the budget year we're addressing with this grant. Our target award was $50,000 up to a max of 75,000 is where we said we would cap that. And then the application process was the entire month of June. And then we are to report back today, which is why we are here. And then when we get to the period of performance, we estimate around September 1st, by the time they do any type of contracting application, working with Emily, things like that. So the applications that we had, we'll start with, we have 3 that were recommending denials. All 3 were advised that we did not believe they were eligible by statute, in that they were not a EMS provider or organization operated by a city, town, or township. First one was Grant County EMS. It is not, it's county-based, not city, town, or township. The Ripley County Health Department cooperating with Ripley County EMS. Again, it's a county municipality, but not a city, town, or township. And then finally, Davies Hospital, Community Hospital, they operate EMS, so they are operating it for that area. But that hospital, it is not a city, town, or township. All 3 indicated that they elected to apply to go on the record, because I know that's a source of frustration from hospitals, county-based, from private service that ran. And again, that's something the legislature could change if they elected to. So we will be recommending denying all 3. You can either take up that action right now.
So moved.
Second.
Just making a comment again, this is a legislative issue. Quick question, are we addressing that issue with legislation? That would they consider that, or is that taken outside source?
The governor's office, we had gently approached whether it was something we could pursue, and they said they would prefer that the people, the interests, the bodies pursue that themselves to change the statute, because we did not put that language into that statute.
So the motion is to.
Deny.
We have a second. So, what do we have in the roll call?
Matt Shady,
Aye.
Darren Hogan,
Aye.
Dr. Clooney,
Aye.
Patrick Hutchinson,
Aye.
Lee Turpin, Jerry Harder,
Aye.
John Zartman,
Aye.
Dr. Brown,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley,
Aye.
Dr. Nothin,
Aye.
Lori Maley,
Aye.
Director Thacker.
Aye.
And that's just a point of like anything else that goes to medical services. If there's legislation or regulation that you feel strongly about, make sure that the commission knows about it, make sure that those district managers know about it, make sure your constituency that is over you, that you elect knows about it, so that you can have an active role. Moving on to full business.
No, that was just the denials, you got it approved. They prefer to receive someone.
And then they can't wait.
So there are 6 organizations that applied. We and Emily provided an excellent job. She brought staff together, and then in your packet, you have a full sheet. I condensed it here, so it still is a little bit, I probably need my glasses on to see it, but it is in your packet, and it does have all the columns for the priorities. And we did consider them, and then we get a budget and we get a specific proposal so we can answer any questions you have on those. But succinctly, what we have is, first of all of them put together were less than the 500,000. And so it wasn't super competitive, we just had to look at, is it a qualified program? And then is it reasonable what they're requesting? And we did modify a couple of them and got additional information to make sure that it was something that would qualify as part of the MIH program. And so starting with Gas City Fire, they were denied last time. They were just applying to become a organization. An approved MIH organization, and it appeared they wanted to buy a vehicle, and we weren't sure if that was like a response vehicle or an MIH vehicle. They followed up immediately after the denial and got approved, and they have a program, and they have worked closely with Emily on it. And at this time, we believe that the vehicle and the other costs are appropriate for the type of services they are providing. And so we're recommending approving $50,815.70. Indianapolis EMS would be expanding their program, and they are wanting to look into more, as I understand it, telehealth and some other opportunities. And this would be technology funding for laptops and radios and such that would facilitate that. And we are recommending approving $74,308.20. Cicero Township Volunteer Fire Department is a newer, didn't they apply at the same time?
Yes.
Yeah. And so we are recommending, they have some safety programs they'd like to do, and we are recommending funding the $50,000 there. Crown Point Fire Rescue is a new program. They were requesting 75,000. That'd be reporting software, medical equipment, and then training cost. And we are recommending approving that contemporaneously with the approval we just did for their program. Goshen Fire would be a new program, and they are wanting to cover personnel costs to start up, but they have a plan to cover those costs long term. So it'd be a stopgap because we always are concerned, that they realize this is not a grant they can repeat for the same reason. And so we are recommending approving Goshen Fire for $75,000. Finally, Bloomington Fire Department had an expansion program, and they are wanting to do part of the cost of a vehicle, training equipment, and then community outreach. And they have some really innovative ideas, like covering some of the CPR for some of the needs of their clientele. And it looks very innovative. So it's a little bit of a pilot as well. So even though they're a well-established MIH program, it would be an expansion. We are recommending approving the full $75,000 they requested. Should you approve all those, when you add it up, comes to $400,123.90 for all six. And that means that we would not account for $99,876.10 in this cycle. The options are we can reopen applications later in the year for that 99,000. But if we did the same grant structure, it would be one or. So option B would be if we see an appropriate new candidate that comes in that has a need, we could come back to the commission, on a case by case basis with that fund. Or option three, it is statutory non-reverting fund, which in the state terms means at the end of the fiscal year, it doesn't disappear. So if we didn't spend it this year, it would tag on the next year. And so I don't know if you're prepared. I would recommend approval of all six for the grand total of $400,103.90. And then I would request input on the options of how to proceed with the balance. So maybe two different issues.
Let's tackle the first one first. Do we have a motion? Motion to approve, recommended. Motion approved by Commissioner Zarvin. Second by Commissioner Vogel. Any further discussion?
I do have a question. What's the criteria for matching funds? I see some have matching funds and some don't.
The way it was written is it says it is a priority, so they are not required to. When we get into the competitive areas, which we have had in the prior cycles, then we weigh it, because we're like, if they're willing to invest 50%, we're going to rank that grant application higher. And so it honestly did not factor into this one because they were within the funding available. Thank you.
So we have a motion and a second. Under discussion. Let's call for the roll.
Matt Shady.
Aye.
Darren Hoggett.
Aye.
Dr. Clooney.
Aye.
Patrick Hutchison.
Aye.
Lee Turpin.
Aye.
Carrie Harder.
Aye.
John Zartman.
Aye.
Dr. Brown.
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley. Aye. Dr. Nossett.
Aye.
Lori Maylie.
Aye.
Director Thacker.
Aye. This next one, the suggestions on how we go forward.
And I don't know that we have to have a motion, but it'd be nice to at least have a consensus. And maybe you don't, maybe we just take it under advisement and then we can act when we see appropriate.
Director, can you mention that if we reopen applications, you said this would fund just one group?
Unless we lower our, we did it under the same similar NOPO, it would fund roughly part one and part of another, if they're about 50,000, maybe two of them.
We're just less than 1,000 shy.
Yeah.
Yeah, I guess my thought on Greg is that, we're halfway through the year. It'd be better maybe just to roll that money over in the next year.
And this is on a fiscal year, so this year started, last year, we were late when we approved them, we were in the last half of the fiscal year. So we actually have until June 30th of 25 for this fiscal year. So we could do it in like January or December if we reopen.
It's possible just leave the application open.
Yeah. That's true too, they missed the deadline, but if they apply, then we could bring it, because we still have to have the approval by statute without this body.
Maybe a deadline extension.
If I can make a comment, I think that the commission as a body that represents EMS throughout the state should not remain silent to the fact that this is discriminatory. Some communities, the fact is their EMS is provided by county-based services, as we've been discussing. I would love to be able to find a way to work with the legislature as the commission working with the legislature and not as individuals reaching out to individual representatives. I feel like we should not be silent on this. This is discriminatory.
So I think, and so just to address her question before you discuss it, kind of question for comment. Whatever you have, because this is part of the governor's office, your governor's appointees, then I think we do have to be a little cognizant of that. But I think the commission could send feedback. I don't think you can, I would not recommend demanding a change or something, but I think you could send feedback that we could relay if there is concern with that statutory provision.
If I may also too, I've had a lot of outreach over this over the last several months and years. And there is a group that's kind of getting together to try to enact some change. So that's usually what I do when somebody reaches out to me, is put you in contact with that group. So any of you that do have concerns individually, I would be happy to facilitate that as well. So just reach out to me.
That's why I started to each individual commissioner. Concerns on that, just send those out for meetings and you can file thoughts on that,
So I've said, I'll get you all together and make sure that it's not a bunch of individual voices.
Could we draft a letter to the governor's office, just clarifying? I mean, from a political cycle kind of thing, the current governor's office doesn't necessarily influence what would need to happen in 2025 to change the statute, correct?
So usually any legislative changes happen well in advance. So I think it would be the current governor's office that would look at for 2025's legislative changes.
So maybe if this body just drafted a letter stating that we are in favor of adding county and hospital-based systems to remove the discrimination that currently exists, would that be helpful?
I think, honestly, knowing the process, the best may be if you guys wanted to take a position, then you might encourage IDHS and the governor's office to consider legislative change or at least support it. And then that would go into our legislative agenda and we could see if it's something that they would consider. And we would know that the commission has spoken on that.
So I'd like to make a motion that the IDHS staff work with the governor's office to address this disparity that exists currently.
Yes. Thank you, Mike. Any further discussion? Okay. Roll call vote.
Matt Shady,
Aye.
Darren Hoggett.
Aye.
Dr. Clooney, Patrick Hutchison,
Aye.
Lee Turpin,
Aye.
Jerry Harder,
Aye.
John Zartman,
Aye.
Dr. Brown,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley, Dr. Nassif,
Aye.
Lori Mailey,
Aye.
and Director Packer.
I'm gonna vote, so I'm gonna vote, I'm gonna abstain, because the letter will probably come to me to work with the governor's office on that. And so, with that caveat, I will abstain.
Just a note of the statutory, because the outside, there is seems to be a little bit of disparity there. But this, same thing occurred back in the early 2000s with the HRSA grants. And originally, it was pretty much the same type of model. And the federal government did an assessment on that, because at that point, I believe, county-based EMS providers and private schools, I think hospitals were at that time, federal. Federal law obviously does not match up with legislation from state, but they came back and opened it up to any type of EMS agency later on. I think it's probably where we need to end up with, because I think we have all types of providers that are engaging with this from the good. So I think it's in our best interest to lend gentle support back to this and see change, especially when we're not spending. Because it can be used for community impact regardless of the provider type. It's good arena in the end. Anything further on MIH?
No, I believe that addresses everything. Thank you. We appreciate the input from everyone on all of this.
Business. Administrative proceedings.
I'll do the first part. Now I'm going to turn it over to our counsel, Lori Egan. Waiver orders, the staff does on behalf and with the waiver orders, they are listed there. They're available in your packet. Pretty standard ones, but we do include them. So that way, if you want to read through and you have any concern, then you can follow up with us. Discipline orders, you always get a copy of the discipline orders that we have sent out. And probably the big ones that in there in your packet was an initial EMT denial. And that was due to someone that we determined was cheating during the testing practices, during practice. And so that person is denied, as an EMT, based upon that. Administrative rulemaking, I'll turn over to counsel.
Hi, everyone. Lori Egan, Deputy General Counsel with IDHS. We have two Title 836 rulemaking processes going on right now. The first one is just the readoption of the entire existing Title 836. And as we discussed in an earlier meeting, we decided to renew the entire Title 836 so that going forward, it's on the same schedule and we're not having to do it like by piece every year, which is a bit tedious. And so we are at the end, the readoption, the rulemaking process is much simpler than actual regular rulemaking. And so today, all we need, just a brief update on what's occurred so far. On May 8th, the notice of public comment period was posted. And so there's an open public comment period for the public. It's on the DHS website. No public comments were received. And the public comment period closed on June 7th. So today we are just asking for the board to take a final vote to just approve of the readoption. And then I will ask Chairman Turpin to sign the signature page. And after that, we will be just submitting it to the Indiana Register for them to finalize the process. So this just ensures that Title 836, nothing expires.
That thing that they did.
Yeah.
Approve by Commissioner Zarvin.
Second.
Any additional discussion?
And they'll bring back around to the rewrite. Yeah, this keeps the existing, but it's much harder process. Well, this was still more challenging than prior years on the adoption. Yeah, we can still pursue the
Call the recall vote, and I'll get the pin.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Dr. Clooney. Aye. Patrick Hutchison.
Aye.
Lee Turpin.
Aye.
Jerry Harder.
Aye.
John Zarpman.
Aye.
Dr. Brown.
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley. Aye. Dr. Noffitt.
Aye.
Lori Maylie. Director Thacker. Your pen is ready.
All right, I will go ahead and go into the next agenda item. So this is another rulemaking, but this is the regular rulemaking. And this process is a bit more tedious and with new legislation, it's become even more so. So we are in the middle of the regular rulemaking process for the proposed new language that incorporates the AEMT certification language and the National Criminal History Background Check language. So the AEMT, the reason this has to go into regular Title 836 is because it's currently an emergency rule, and statewide, all emergency rules are expiring on October 1st, 2024. So we need to make sure this rulemaking is finished by October 1st, 2024. And then the National Criminal History Background Check, this is just a nationwide requirement now. So that is and so as far as where we are with this, it took, the first hurdle is just getting the official approval letter from proceed, and they're pretty thorough, and we put together the regulatory analysis. And so we got that approval letter. It took a few months for us to get it, but we got it. And so that following that is another public comment period. So we're in the middle of that right now. So that will end on July 27th. So the public has all this time to submit comments, and then a public hearing is taking place on July 29th. And so we, as you all are aware, have to have a regular special meeting. And the reason we have to do this is just to, we have to get the final vote as soon as possible, because then there's 2 more steps involved. The AG's office has to review everything, and that takes a matter of weeks, and then also the governor's office. So we just have to make sure that everything is completed by October 1st. And apologies for having to have a special meeting, but it is very time sensitive.
I did put up there, sorry, I don't think Emily has sent out yet. She'll get an email. The special session is Monday, August 5th at 10 a.m. Is the date we ended up selecting, so I'll be out here. I will note, we'll send a reminder. That is the Fire Chiefs Academy Week, and they are out here, so they are in half of this room. So I'm not sure which side we'll be on. I'll have the EMS Commission banner out, but before you barge in, you might want to make sure you're going in the right side.
One more note, the public hearing, you do not need to attend that. If you would like to attend, please feel free. It's virtual and in person. I'm not anticipating public comments. We might get some. But typically with these hearings, it's just me and one staff member, and we just sit there for 2 hours waiting for the public to call in, and typically we don't get one. So do not feel like you need to be there.
If I recall from the stroke rule, then you have to bring any comments here anyways, right? So.
And a certain number of commissioners do be present.
Yes, yeah, we have to have a quorum participating that day. I had 14 people say they could, a couple were virtual. And half the people have to be physically here. So we can try to coordinate closer, but we just want to make sure that we have the in-person and also the go. Because we don't think it'll be a long meeting unless there are a lot of comments that come out. It'll be a pretty quick. The appeals docket.
All right, the next agenda item, I'll just give a brief overview of what the commission's role is today. So Chris Mitchell, there was, this is the case with a petition for review. An evidentiary hearing occurred before the administrative law judge, the ALJ, and the ALJ issued its order, denying the petition for review. Well, essentially the initial revocation order that was issued by IDHS. I should have started with that. This individual's EMT certifications were revoked because of a criminal conviction involving a minor. And so the ALJ issued its order, and Chris Mitchell appealed that. So you have this appeal right. And so he emailed, and so the commission's role is to either affirm the ALJ's order, which keeps the revocation order intact, or you can remand it back to the ALJ if you think that more fact finding needs to take place. the commission's role is just to consider that we're not having a hearing today. So we're not having testimony or anything, but just to consider his, appeal that was, an email, and then just IDHS submitted just a response to that, just stating our stance that we would just ask that the commission issue a final order affirming the ALJ report.
Make a motion to maintain the resignation.
We have a motion to maintain and seconded by Dartman. Any discussion? Hearing none, we'll call for your call.
Matt Shady.
Aye.
Darren Hoggett.
Aye.
Dr. Clooney.
Aye.
Patrick Hutchison.
Aye.
Lee Turpin.
Aye.
Jerry Harder.
Aye.
John Zartman.
Aye.
Dr. Brown.
Aye.
Did I see Matt McCullough come on?
He's on.
Matt McCullough.
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley.
Aye.
Dr. Nauset.
Aye.
Lori Bailey.
Aye.
Director Thacker.
Aye.
The last thing on the administrative proceedings, we have an appeals docket. Now is something that our general counsel suggested, so the commission just knows what appeals are going on. Matthew Copeland has been pending, the ALJ. This is my interpretation because I'm not counsel. But they're kind of be tracking the criminal case on that one. So that was why it's been pending for a while. Troy Delaney, there was a hearing you may have seen in the news, and an ALJ has heard the case both on the fire and the EMS side, and it is under advisement. And we believe you believe she have 90 days to make a ruling. So we're just waiting on that ruling, and then it'll come back to because that was started before, I believe it'll be a not, but it'll come here for consideration like we just did with Metro. And then Troy Loutham's a newer appeal that's just in the preliminary hearings.
Just one quick, thing there was one, statutory change that we touched upon at the last meeting. Cases that begin after July 1st, the ultimate authority is going to be the OALP. But for these cases that are pending, you all are still the ultimate authority. So we've got some pending, but after that, it'll be just OALP, and we won't be coming back here.
Moving on to staff reports, data registry. Ken Watson.
Good morning. Can you hear me okay?
Yes.
Okay, first, what I would like to report is I am happy to say that our EMS reporting percentage in June was 100%. And I also calculated our fire department reporting from January 1 this year through June 30th. And that is at 71.4%. Many fire departments I have seen tend to report at year end or shortly afterward because the language of the reporting law requires an annual report. And although it doesn't say it has to be a year end report, most or many fire departments assume that it's due shortly after the end of December each year, which causes a tremendous data surge during the December, January, and February. So we're encouraging any fire departments that may be listening to this to report monthly if they can, rather than annually. And because of that data surge in that I expect in late 2024, I think the percentage at the end of 2024 will be closer to 80% and perhaps higher. Tasks I've been working on, there's a large increase in the number of requests for image trend assistance, largely due to Rhoda I just referred to, a nearly 100% increase in fire departments reporting during the last 2 years that the fire department reporting law has been in effect. And many of these fire departments have been using paper up to this point. This is their first endeavor to use electronic reporting. So they do require quite a bit of assistance. I'm also working with the MIH data team, have created a new MIH data collection form with input from Dr. Yezel and the MIH data team. It is finished and it's capable of collecting data, and will begin field testing in the next few weeks. Our data intern, Rakesh Reddy Yenam, has been working on NEMSQA compliance analysis. For those who don't know, that is the National EMS Quality Assurance Organization, trying to determine where Indiana matches up with their measures of performance in EMS quality assurance. Rakesh has also been cleaning up the databases and image trend, very important task, which needed quite a bit of attention. And he is also assisting me with requests for image trend assistance. That's all I have. Is there any questions?
Thank you very much, Ken.
Thank you.
Operations report, Robin.
And Rakesh is here with us today. I tried to explain to him a little bit about how the commission works and whatnot, and he was impressed with your gavel this morning, so. But I would also like to say that, how long have you been with us? 4 weeks? 8 weeks? It's taken me until 2 days ago to actually challenge him with some data stuff. So I've met my goal to challenge. Okay, so for operations, Stan Frank is in charge of the equipment grants that went out and were awarded. We are only about 50% of providers that received those equipment grants to submit for reimbursement. They have until the end of September, so just want to make sure that everybody's working on that. Again, ACADIS, you guys have heard it. If you don't have permissions in ACADIS, please get with me, with your district manager. We can do that. We're moving the provider organizations over to ACADIS. Every day I'm putting somebody in. Also, just a reminder, if you haven't watched any local news for those people, especially coming into Indiana, don't forget about the I-465 northbound closure that starts tonight. From I-74 to I-70. That could delay your patient transports if you're taking that way coming into Indianapolis. That's all I got.
Actually, they get I-65.
Is it I-65? I couldn't remember if it was, okay. Okay. And all the ramps that merge into that. Fun times.
Thank you. Certifications of compliance.
Thank you. First of all, last time I reported on how to reach us because we were having some challenges as IDHS updated on our technology. I'm pleased to say I believe it is working now. The changes we did, if you still call the main numbers, the 232-2222, or the 800 number, we now have the EMS option. The reason we were left off, it wasn't explained to us. The reason we were left off was because you're operating under Cisco and the new system is under Microsoft Teams calls. And so they couldn't add us as an option until they integrated us into the Teams. And so you can call us through those numbers and press 6. We do have a main EMS number I've highlighted there. 2 older numbers still exist. The 2326425 will reach operations, which will go to Robin. And then the 2347322 will go to the service person. And so those are good contact informations on how to reach us. We do still have support tickets. And with that, you can select it off of our website. And when you do that, that's a good way to ask for an update or even a general inquiry. They have pull down boxes, everything from certifications, reciprocity, CADIS portal lockouts. You can request anything in that, and it is assigned to a staff member. And honestly, that's the quickest way to get a response out of us. So where did we stand last quarter? Because we ended June 30th. We did pretty well. When you look the numbers were a little bit lower renewals. I think that is, when I say renewals, the actual numbers, I think that has to do with more cycle, not necessarily that we lost people. And when you look at the numbers that elected not to renew, those are pretty on par for those levels. So we did not see much of a change there with the second quarter or the half year. We are down 373 people from the last time I reported, so not too bad. Holding in there at 24,500 seems to be where we kind of hover, which is good that we aren't losing. But on the other hand, as we've noted, it's been that way for almost a decade. So we aren't gaining when we have a lot more needs for them. Audits from April 1st to June 30th, we had 188, 25 audits were incomplete with no response, about 13%. The National Registry has stolen our catchphrase because they like it. We attribute that to push and pray when people just hit the button and hope that we don't audit them and then they don't have the credentials to back it up. We're assuming that's why they go radio silent and we never hear from them. We did issue 2 certification dishonesty sanctions for the second quarter. On violation statements, we had 19 individuals that notified IDHS of an arrest. 15 were cleared. 2, we've asked for more information. 2 have criminal cases that we're tracking, and we don't have any pending for review. I have a little bit more on staffing in my director's report, and I will talk about the certifications position. As I transition to the education report, I don't know what it is with my staff, because earlier this year we wished Stan a happy birthday. It is actually Carrie Lanham's birthday today, so I'd be remiss if I did not call her out and wish her a happy birthday.
It's nice of everybody to gather for my birthday. I appreciate that. Did you have anything else for your report?
No, education's next.
Thank you. That was fun.
Education, training.
I'm one of those people, I actually like my birthday, so I'm kind of weird, but anyway, so. First slide, I just thought, Craig and I both came across this on Facebook. We thought this was interesting. NREMT has been putting this on their social media, just kind of explaining what that new certification exam is going to look like. The length is a little bit longer now. The candidates will have 2.5 hours to complete the new paramedic exam. And of course, we've been talking about some of the new technological advanced questions. There'll be build list, drag and drop options, graphs, scenario based. Their EKG tracings are much clearer now too, which is really nice. Let's see, they also have increased the number of items or the number of questions on the exam. It's a minimum of 110, but can go up to 150 as well. And item responses, basically, you don't get any partial credit, so it's you get the question right or you get the question wrong. So again, you can find that on the NREMT website. So I attended this week, I think it was this week, NASIMSO Education Council online meeting. And there were a couple things that they pointed out that I thought was interesting that I wanted to pass along. They are drafting education standards for community paramedics. Also, they mentioned for critical care paramedics, but I thought the community paramedics was very applicable for the state of Indiana. So something we'll be watching. I don't think they're going to be finished with the project until, I think, Emily, I said like March 2025, but it's something they are working on. Along with that, they are actually collaborating with NAMSI to come up with instructor standards. And that's something that I did volunteer to be on that committee for. So I'm kind of excited to see what we come up with. So stay tuned about that. And they're also they've developed student minimum competencies for the EMT level. They're currently kind of holding back on that. They're waiting for National Registry is going to be looking at their BLS practice analysis. And so that is currently in the works, but they're also doing it for an EMR level too. So a student minimum competency, if you're not familiar with those, recently, within the past year, the EMS Commission had adopted that for the advanced EMT classes. And the paramedic classes already have that to accreditation. It's basically how many ventilations they're going to get and specifics along those lines for their skills. So I'll keep you posted on that. There was some discussion amongst all the states about whether they do or do not allow outside people, outside students from different states to do clinicals in their state. So that was kind of interesting. And then I'll have some more updates in September when we meet again. So I thought that was pretty interesting. We don't have any more slides, right? It's just those two. Okay. So going back to reiterate a little bit about what John Zartman talked about, we have been working hard on the AEMT psychomotor exam. And as he said, we're looking to start that August 1st. I actually just sent an email out to somebody who had a class that finished up July 1st. So I'll be working with them to start, hopefully that first week in August, so we can get that ball rolling and have our first test, first beta test. We have a couple other courses. Their instructors have reached out and they are excited to get that scheduled as well too. What we're going to be doing initially is we're going to be providing the evaluators and the state reps until we can get more people trained. The scenario writing committee, which is, I think we have 10 people on there approximately. Everybody has that did the scenario writing discussions. They all agreed that they would love to be a part of this process. They would help out as evaluators and as state reps. And so we discussed too that we want the people that will be evaluators and state reps. We want to go over those scenarios so everybody is familiar with them and we can work out any kinks that we think might happen. So we're all in agreement when it comes to if a student happened to do this or do that. So eventually what we'll do is we'll reach out and we will train more people, but we really want to keep that those group of people highly trained and up to date on the scenarios. So initially it'll probably be John, you'll probably end up helping me, but we'll probably have John Zartman, myself, and a couple staff members who will fill those roles, a couple exams. Just as a reminder, we'll have one out-of-hospital scenario, and it'll be about 10 to 15 minutes long. We'll have an oral medical station and an oral trauma station. And PED scenarios are a possibility as well too. So we came up with some really great scenarios that again, Dr. Nassif and Dr. Yezo will be reviewing to make sure that they're happy with that. Other than that, I think that is all I have to present. Any questions?
Clarification for the, on the advanced EMT, we started this process with the EMT level and we ultimately would like to go to a similar with the EMT.
Yes.
The advanced EMT by the registry eliminating theirs created a time deadline, but it does make for a good pilot. And that's why I suggested the word, because of the fact that the advanced EMT, we have about 600 to 700 and only about 10% come in each year. So we have 60 to 70 new students, 60 to 70 new candidates. And so it's going to be very, hopefully more manageable.
Yeah, and I think extending this down to the EMT level and then even to the EMR level will be great because I think most people would agree it's kind of antiquated to have the 7 stations that we currently have. So, well, thank you.
Okay. State EMS director report.
Hey, staffing update, we currently have no certification staff. Ashley Johnson was with us, did a very great job. We thank her for her work. She is still with IDHS, but she transferred, she had background and has transferred to the fire investigation section. So she is still with IDHS. We have requested, and I said, hope to post soon. Director Thacker made Robin and I's weekend, because he informed us that we did get approval and we'll be posting both positions coming up, the next week or so. The EMS certification specialist is that role that Candace and then Ashley perform. We have added an EMS certification section sheet, and that would certification systems section sheet. And that person would be over certification, they'd be over MIH, and they'd also be in higher level planning. So they are at the same level as Carrie and Robin, and would take over the certifications reports, for instance, here at the commission. So both of those will be posting. I'm hoping that they did a comp study, as I can't remember if we addressed, but that was done like a year and a half ago. And so the positions are still not always as high as outside, but very competitive with good state benefits. And so I'm hoping we have good applicants. So if you think of people that may be interested, then keep that in mind. And certification specialist is a little more centered to processes and office work. The section chief role would be doing some travel, do some office work, but also long-term planning and things like that. So that is a kind of deputy administrator role. So hoping we can get some good candidates when we post those. There is that depiction of where that new one will come in line with Robin's operations section sheet, and then also with Carrie's education and training section sheet. We do have some website changes, a little hard to see on there. And if you go onto our website, they have now created more hot buttons that'll take you in a more streamlined look, and it matches the rest of IDHS's web pages. And so the idea is that we don't clutter as much on our main landing page. This is a little bit of a close-up there of what the main buttons are. And one of them that well, I guess I'll get to that in a minute. Certifications. This is an example. I think a lot of people are used to going certifications. Used to, when you selected one of the buttons at the bottom, you had a bunch of options. You may notice they're gone. And so you may be like, yikes, where did they go? Well, under certifications, for instance, I think in the old website, there were like 7 or 8 items. All those are on the certifications landing page now. So if you click from here and you go to certifications, you would then find the documents that you have. One of the cool things I want to thank Robin for suggesting, on here on the main landing page, forms is on the right as a hot button. And so if you're used to, you're like, I wish there was a form search, you either know the name or the number, like continuing education, then it'll take you to a landing page that is alphabetical. And you can see, so all the A's, so there's some of the advanced EMT forms, and you can click on them there. So I think that'll make it easier to find forms, and that's something we've not had. We also then have, if you go under the S for the state forms, you can find the numbers. So like if you always know, I do not. I'm the director, but I don't have memorized state form 8815 problem. That's a lot of that. It's like, there you go.
670.
So if you can look for them by state form number, but again, you have that alphabetical option. I will say, this is something EIO worked and my team did this excellent job. And he had indicated that, it took him a little bit of time because he really had to construct it and look at what all our forms were. So that being, if you're like, there is a form, but it's not in the form section, feel free to email Robin or I, and we will get with him to get it added to the section. So, but I think it's going to be a great tool. Also note at the top, I didn't catch earlier, but our phone is there. And then you can also make contact, and there is the complaint ticket as well. District forms have gone well. I was a little bit sad. I was very sick in June, and I missed, for the first time in the years I've been here, I missed the district forum in Huntington. But staff, as I had no doubts, did an excellent job covering, but we still have 3 more. So we, this coming week, Margot alluded to, we will be down in Vincent University in Gibson County. So it's actually Fort Branch is the actual physical location we'll be at. And that'll be on Thursday, July 18th. And then we will move over to Seymour for August 22nd. And then our final one will be hosted at Franciscan Lafayette on September 26th. So you have 3 more opportunities. Again, those are available in Acatus. We do encourage you to pre-register because if you pre-register, it helps us with the head count. Because I want to thank the EMS Association, which has graciously provided lunches for those forums. And so it does help tell them how many people they're going to be there. There's the rough schedule. Usually we've adapted a little. I didn't get it changed here. We're running about 9 to noon as our kind of updates for current issues and changes from the last 2 years. And then we have EMS Association, we go into lunch. And then we have breakout sessions for medical director, hospital interactions. We have one for mobile integrated health. We have one for EMS education. And then Margot has been attending and doing pediatric education coordinators. Yeah. And so we do encourage attendance there. It is local time zones. So if you, and we try to put on the schedule, it's not on this one, but on our flyers, we have if it is one of the central time zones. Indiana EMS 2025, only update I get there is, my apologies, did not get a lot of assistance. So I have a lot of recommendations. And then we have findings and recommendations, which we've agreed upon. We're still working on the rationale slowly but surely. Our goal was June, but when we talked it over, the recommendations we have, no one really tasked the legislature with changing anything. And that's why we were pushing it to rush it out, just so that they might use some of this. And so since we have a little bit more time, that's why it's been delayed. But we still will have a report. We have excellent findings, excellent recommendations. The group did a great job. We just need to get it in that report format. And that's been on myself and the team. And we plan to do that. Health First, EMS Readiness, that's where we received the roughly 6.4 million fiscal year. Last one. Hand-heavy update. We are still enrolling people into this, and most of the people that signed up are enrolled at this stage. If they were existing, then we covered 25% of their annual cost for that year. If they covered 75%. If they were new, we get a 50-50 split. But we also, the new also carries setup costs because it integrates your actual protocols. So there's setup fees and training. And so we cover those costs for new enrollees. There is a wait list, so we can get you with hands-heavy. If you are interested and did not get in, then we can get you on a wait list because we are in year 2 of readiness. This opened July 1st, so we may be able to fund more as well. Part of the agreement was we would have instructor courses in Indiana. They do have online ones, but they provide in-person. They are going to do 4. For those of you good at math, there are only 3 listed up there. There is a reason. We have these scheduled. The 4th one we believe will be up at the MAC Center in Northwest Indiana, but it's a little farther out, so we're still getting the date scheduled for that. The ones that we know of are Plainfield on July 22nd. We'll actually be right here. July 23rd, we'll be in Fort Wayne the following day. And then French Lick, who is one of the pre-conferences on November 20th with the EMS Association's Crossroads Conference. And so we do limit it to 1 student per department, and you have to be a client with them. And if you are a client with them, you can work with them to get enrolled in that. So that will help you then better train your own staff participating in that. Training institution grants, you heard from Robin, just make sure we awarded 1.3 million, make sure the people that were awarded are purchasing the item. and requesting the reimbursement so that we are able to cover it in that grant cycle. Online education, we did do a negotiated bid. School of EMS was awarded that contract. In the 2024 planning, we have a few courses. There are 2 EMT courses, and I have them up there, and they are enrolling students, and I'm hoping to get information out through our public affairs. I've submitted it. We do get questions because it is free. Once they vet and make a determination, then it is a free program sponsored by EMS Readiness. So I get people that are, because School of EMS is marketing it, we're getting questions like, is this a scam? You know, are they getting us in and they're going to hit us with this? It is not a scam if you are one of the people enrolled in Jasper County's class for the West Haven Springs. And so those are 2 opportunities, and where we picked those areas for year 1 was I tied in that Bowen Center workforce study. And if you remember, they had a map of training institutions, and I picked areas that had 4 contiguous counties that had 1 training institution or less between them. And so those are the counties that get priority in that. And so the other area that we have 1 paramedic class that we're starting in 2024, and that will be in East Central Indiana. And it looks like it'll be at Winchester Fire Department. There has not been an announcement on it yet due to the fact they have to clear it with COA because it'd be a satellite site to their agreement. So once they get accreditation approval, look for announcements on that. These are open, all 3 of these, the 2 EMTs and medic, open to anyone in the state, but the priority will be given to the named counties in the contract that have the biggest needs. We will look at, we have opportunities for the next 3 years going on now. This was year 1. So we have potential for 3 more years for classes. So we can continue to look at, you know, the training institution map. But if you see a need in your community and you're like, man, we really need EMT or medic, why didn't they choose our area? Feel free to reach out because we want to make sure we're meeting the needs of the state. And so we will be looking at locations for year 2, probably after we see how these first batches, at least the EMT, the medic class is going to take a little longer. We have retained Bowen Center and they are continuing on year 2. So we have work, including a dashboard going on. And then our negotiated bid for the electronic test prep package was awarded to Jones and Bartlett. And we are reviewing what resources are available. And we anticipate an announcement coming soon on that. The idea would be to have an opportunity for, as we looked at it, we have 2 different programs. And so I think Carrie's going to discuss it at her instructor updates later this month. But we want to get feedback because one program is more true test prep into the course, getting ready to take the registry, electronic testing, and more kind of BizDap based. The other one is an ongoing course one that the instructor can use as well for their testing in different modules. And so we anticipate we might actually give it to, you know, if the training institution wants to do it, then they could use the one that's more advanced. But if they want it to be more student-based, then they can do the other. It kind of gets into the how active the training institution wants to be. Because if it's just a resource they want for the students and they don't want that control, then the actual true test prep may be the better option. Rapid update.
Nathan is grants actually closed now. We're reviewing the bids, and so hopefully we'll have an announcement here very soon and up and running. So really excited about that potential. Again, you know, number 1, service provision for some areas that really need it. Number 2, hopefully some great data that'll make our case for improvements down the road too. So excited. Again, hopefully we'll have some announcements on the awardees very soon.
Upcoming EMS projects, we did do the new contract with Cadis. We are working on that education tracking through your portal account where you can kind of keep your continuing ed. You don't have to rely on that old paper form like we do now for most of us. And then we also are working on public search feature to verify credentials. That's a little easier than the one we have now. And our goals going on with that money would also be instructor development for year 2. Partner updates. EMS Compact proceeds, no real announcements there. We're doing a lot of education. We may see our executive director, Donnie Woodyard, come to Indiana and present at a couple events. The SIMSO, you heard we are active, staff is more active with it. I'm glad we are because it's a lot of great resources. I'm still involved. I'm still on the board of directors and the executive committee. We are, Indiana's hosting the Great Lakes Regional Meeting. And once I get that information, we're hoping to share, I'll share with the commission. I know Andrew asked and attended the last time we hosted it. If you are interested in attending, then that is something you can do. National Registry of EMTs will have a November board meeting. I'm not familiar with any major issues. We had a lot of updates, but no major items. And I think there was purpose to that, was knowing that July 1st deadline, we didn't want to task staff. And so we'll see if anything comes up there. Nothing to report from an EMT or AAA. I know they are active on federal legislative matters. Unless there's questions.
Any questions for Rick?
I will email that.
Hearing none, we'll move on to the EMS State Medical Director's report. Dr. Gates.
Just a few things to cover. Number one, you've heard me talk before about the mental health initiatives. Really trying to work forward to have some concrete offerings of support from the state level to our services out there and, you know, what that actually looks like. Really had some good support from the Division of Mental Health and Addiction in that, and they're working with us for that service delivery and more importantly, even to build off of what we initially put out. So we've had some really productive meetings with them. Look forward to reporting out as we move forward on that. You heard me talk about the CARES registry. That's still moving forward as well. IDOH is going to actually house the state coordinator position. I think they have a job description that's, you know, they're looking at filling that with support from Homeland Security as well. So that's moving forward also. As you heard me talk about between the CARES registry, some of the Quality Alliance data, I've talked about the behavioral health and PEDS data projects. Really looking forward to be able to provide the individual services some very actionable dashboards of data that I don't think we've been able to give in the past. And so, you know, I think you'll see a nice laundry list of where you stack up and things like that and help you guys. So really looking forward to seeing where that goes. Whole blood, we now have 4 services out in the state doing a field level whole blood ground from the ground side of things. Had some good outcomes, a lot of interest from other services. And one thing we'd like to do is so that each individual service that's interested isn't trying to reinvent the wheel from ground zero. We're coming up with kind of a database where if anybody's willing to share their protocols, you know, some Q&A where they can post, hey, this is some barriers that we ran into, some things like that, so that you, if a service are interested, you can look and say what model fits our local environment the best, because there's a lot of different ways to get there, just depending on what your resources are and things. So I think that'll help save some time. If you are interested, please reach out to me. That's one that I'm really active in and love to get involved in. One thing I think you guys heard me talk about it last time, but I'm worried a little bit on some of the provider trainings that are out there from a residency side of things. There was not a single OBGYN residency graduate that stayed in the state of Indiana last year. And so you're really starting to see some OB deserts out there. Obviously that trickles down to what we do day in, day out. Just got out yesterday, only 42% of our family practice residents stayed in the state as well. So that a lot of times trickles down into our rural areas, our critical access facilities. So again, something we're monitoring, we're watching that data and seeing what that trickle down effect looks like to our boots on the ground folks. So just something to be cognizant of, and again, you know, maybe look at your training regimens and adjust accordingly. Just to kind of double down on what Margo said earlier, please get in EMSPedsready.org and look for your local services. a lot of that contact information needs to be updated. So sometimes she's making phone calls to folks who aren't involved anymore. I think some of our non-transport services, don't think they're not, they don't need to fill out that survey. Those do count in our numbers as well. So if you get a second, get in there. It literally takes seconds to pull up who's in your area that hasn't filled it out yet, and just send them a text like, hey, can you do this? I mean, that kind of grassroots stuff really will get us over the top, and it's important to get to that 80% for a myriad of reasons. So please take a little time and do that. Down to just a handful of counties that I haven't been to yet, so please reach out to me. Any of your audit reviews, or anytime you just want to sit down and talk EMS. A lot of these things that we're doing out there and initiatives that we're putting together are a direct result of some of these just off the books conversations that I'm having when I'm out in the state. So please reach out to me. I think it's a good way for you to stay in touch with what's going on. It's a great learning experience for me. I take something away from every single site visit. State in-service is still going well. Appreciate everybody's attendance at that. Seems like it grows. The July one was a little less, but I think that's a vacation time. But we've hit triple digits a few times, which is exciting. And again, it's a great way to loop in the whole state. So last but not least, just want to thank all our staff. Those forums are a lot of work putting together. There's a lot of travel. We're all over the state. I think it's very important that we get out there, but it is a lot of work. They're doing a great job getting out there and being an ambassador. So I just want to thank them as well.
Any questions for Dr. Gates? Hearing none, we've added a public comment section. With one person listed, Mary Addison, please.
Do I need to come up here or do I?
Come here, please. And please limit your comments to 2 minutes.
I'll go there in that time. That's the main thing now. I am now retired. Didn't ask to be retired. But when 4 administrators show up in your nurse's station and say, this service line is no longer to be offered, your 26 years of service in the facility that you're in sort of sounds like a big flushing sound. So, but I woke up the next morning and I'm still alive. So Meredith Addison started out as an EMT at age 17. Even though I learned later you can't be an EMT until you're 18. I was an EMT when I was 17 because somebody asked me. So I need to know how you go about officially and unofficially recruiting EMTs, because put me in, coach. I'm not dead yet. I will see to it we match whatever numbers you put to me. I was told by the lawyer at State Department of Health we never have a funded state trauma system. We do. Because when you get to the person-to-person level, people really do want to do the right thing. They just see the whole elephant instead of just pulling one tail hair and running away. I'm a doer. I'm a grunt. I never looked to be anything but that. I'm a registered nurse only because I crossed over to nursing because they had a paid political lobbyist at $60,000 a year back in 1979. That's a lot more money than volunteer EMT. But I started out as a nurse's aide at $1.35 an hour. I went first as an adult outside of Indiana when I went into the Army, and I was good to go do promote through basic, through advanced, and through command and general staff school, which is where I learned at Fort Sam Houston, Texas, we had no statewide trauma system. And I sat there with my mouth open among all these credentialed world leaders going, we got the most mint, we got the most pork, we got the most popcorn, we get $1 million of people just racing around the track every year to show who's fastest. What the? We don't have a statewide trauma system. Well, then, Missy, if you want to address that, you're going to have to go to your by God Department of Health. So I came home to Hillsdale, Indiana, in what used to be County 92 out of 92, according to the Bowen Center for Workforce Development, in unemployment. And I drove 96 miles to my by God Department of Health, sat against the wall with my dinning and my mouth shut for 2 hours listening to the lawyer, went up just like this after the meeting, and he went, because I'm always like this and I'm a foot taller than him, and said, can't solve your problems. Don't have any data, don't have any funding. And I knew he thought I'd drive my sorry, you know what, back home and clock in on time the next day, which I did. And I'm still good to go do promote. But now I'm free. And I will be a volunteer and I will match whatever recruiting numbers you put in front of me at the EMT level. So put me to it, challenge me.
Thank you. Chairman's report. Eagles meeting, the U.S. Consortium of Metropolitan Medical Directors was actually really good this year. There was a lot of data, a lot of things we want to see. The more of the stratification of EMS based on evidence-based medicine, when is BLS necessary, when is ALS necessary? The whole blood issue, a lot of triage related items. I published a set of notes, if anyone's interested in those, we can get those to you. Again, it was interesting that there was very much a weather problem with people getting there this year. I know Dr. Diesel had issues, but what you missed in that was 757 landing in 8 inches of water, which I got to experience and hope I never get to experience again. So that part was kind of, but it still remains a very, very good cutting edge. It's usually a prelude to what NAMSP is looking at coming in the next year on just the raw data of what people are finding out. But it's exceptional. And the point I want to make with that is of the people that did make it, 500 people out of the 900, about 6% were from Indiana, all the way down to Fort Lauderdale, Florida. There's very good representation there. But from all over the state. So I was really, really proud of us to see that. That was noted by Dr. Peter Antebi and Dr. Paul Pepe and several others. So good showing. If you haven't looked at the new OSHA guidelines affecting fire departments and EMS, you probably should. I will kind of do a call out there to say, I'm sure Stan and Frank will agree with me. They didn't address the elephant in the room. The elephant in the room being fatigue. There was absolutely no addressment of the fatigue issue in the new OSHA guidelines, which I was kind of, not that I ever look forward to do OSHA guidelines, but I'm very disappointed there wasn't at least an acknowledgement. So that still remains out there as an issue. Several things obviously coming up that I mentioned today, IDRC, Crossroads EMS Conference, Trauma Symposium, IDOH is putting together. To mirror what Margot said, if you have not done the needs readiness survey, please do. I really enjoyed doing this one simply because it gave me a score at the end that I could look at, and that gap assessment I think was very, very valuable to say, hey, we've got some walking groups here. We got some stuff that we can work on. That was identified in the survey. And I expressed my thoughts to Margot how I thought this one was. It wasn't tedious like some of them been before. It actually gave you something to work with. So very appreciative there. I would be remiss if I don't mention again what Bob Moore said about the Golden Sirens. We have three of them in the room. Robin Stump, the years and mentorship that she has done in the leadership position with the EMS staff. Dr. Nossett, his long-standing history through EMS, involved in AMSP, other areas. I mean, just a name there was very deserving. And Brian Peterson, if you all have not Googled One World Medics, you should. And look at what his organization is doing to provide ambulances and equipment in other countries. What was that number you told me that you've given away now?
We're at 38 ambulances.
38 ambulances donated to other countries and helping their EMS systems grow and establishing those international relationships. Just a phenomenal group of people in E3 and very deserving of that award. I don't believe we have any of the others. So with that, I wanted to acknowledge one other thought from this today. Crown Point, we're in the MIH and utilizing that GEMS course. That is a very highly underutilized course. Glad to see someone's actually putting that GEMS course out there for people. That concludes my report. I would like to note that our next meeting, we do the special session, it's for rulemaking only, August 5th, 2024, May, 10 a.m. And then the next full commission meeting will be at Embassy Suites in Noblesville as part of the IERC meeting. That is going to be October 2nd, 2024 at 1 p.m. With that being said, we reach the end of the agenda, and I will entertain a motion.